I'm John Lasher, Executive Director for Partners in Health in Sierra Leone. Last fall, we shared with you Unchain, our podcast miniseries about the oldest psychiatric hospital in sub-Saharan Africa and only dedicated mental health care facility in all of Sierra Leone. For more than a century, it was not a hospitable place for quality care. Yet for those living with mental health conditions, there were no other options.
This is the first psychiatric hospital in all of Black Africa, south of the Sahara.
Patients were shackled, windows were run down, doors were run down, no toilet facilities. Patients were given chambers to ease themselves from. Patients will urinate openly because they have nowhere to urinate. Water was a problem. The place was not too good. It was awful. It was not fit for human accommodation, to say the least.
Today, things are much different.
What people were saying before about this facility is far different from now. And I believe for now, Sierra Leone Psychiatric Teaching Hospital is one of the best hospitals in our country.
In the last few years, with an infusion of resources from PIH, the hospital has been completely transformed and is now nearly unrecognizable. But no one forgets its history of impoverishment and the role it played in Sierra Leone, historically one of the most exploited countries on earth. It's now almost May, Mental Health Awareness Month. To mark this time, we want to reshare those first 4 episodes of Unchain and to release a new episode that covers more recent updates from Sierra Leone Psychiatric Teaching Hospital and how it continues to find innovative ways to ensure quality mental health care for all, because there are always more patients at the hospital whose stories need telling.
Well, as you have rightly said, the stigma that is associated with mental health conditions in this part of the world, our own reality. The reality is, when once they've learned that you have received care at this facility, this mental health facility, you are stigmatized.
Always more healthcare workers to teach us about compassionate care. And what prompted you to study psychiatry?
Wow, long story. To start with, it as a result of love for humanity.
And always more opportunities to learn from our shared history.
Slavery, enslavement, and the quest for freedom as a process that has deeply traumatic implications on people.
Join us every Saturday in May for an episode of Unchain, with a brand new episode available on May 29th. Subscribe to Unchain on Spotify, Apple Podcasts, Google Podcasts, or on YouTube under Partners in Health. And continue to learn and explore more stories from Sierra Leone and PIH by visiting pih.org. Look for us at Partners in Health on Instagram or PIH on Twitter and DM us your comments or questions. We'll meet you here on Saturday. Happy Mental Health Awareness Month.